Hi friends, good evening. So I'll be talking about the SFT, the single pass forward technique popularized by Dr. Amar Agrawal. We do it in different situations, and I'm going to present you a long-term follow-up. It is commonly used for the traumatic deficiency of the iris tissue, whether it's a primary or secondary. If the deficiency of iris after synectomy removal, and when the optic of the PCL tends to pop out above the pupil, especially when you're doing the penetrating keratoplasty. When you're doing optical keratoplasty, in cases of congenital coloboma of iris, and sometimes to stretch the iris to avoid the crowding at the angle. I hope you know all the procedures. I'm not going to the detail, but what is desired is people should constrict, people should remain in the center, and there should be no gap between the iris tissue which is brought together. And there should be no visible holes in the entry or exit side of the iris surface. And a single SFT is more desirable than multiple SFT. These are special precautions taken. Now, experience will only tell you how much to tighten the stitches without breaking it, how much deficient iris can be repaired, and how to cut the free ends of the knot of the stitch inside the anterior chamber. It's not easy. And normally done in pseudophakic eyes and aphakic eyes, but you can do it in aphakic eyes as well. Now these are the follow-ups. This is a 3 years follow-up of a case, and the knot is good. You can see the knot is good with the growth of pigment layers mimicking the continuity of the iris. The deficient iris works like a peripheral iridectomy. It moves automatically. So, and this is a case of 2 years follow-up with the 26 gauge needle pierces the anterior surface of the iris, and this entry point becomes like a PI. It's cosmetically poor. It's 18 months follow-up case. The knot may open up or break, and the effect of the SFT is nullified. It's 18 months follow-up case. The knot may open up. And the 28 months follow-up, and the pupil may become eccentric because one of the SFT has given way. It is moving automatically. There is a 40 months follow-up. SFT remains intact, but the stitch is marked on the iris surface so that it avoids the crowding of the iris at the angle. In attempt to make pupil pinpointed, especially in cases of cornea grafting, because of inflammations, it may block. The pupil may get blocked, and it looks like that, but it opens up. I don't have the post-op, the picture of follow-up after that, but it opens up. This 35 months old follow-up is a good SFT, good bridging of the pigments. A small PI-like deficiency is negligible and cosmetically acceptable. Is 20 months old follow-up and clearing the peripheral anterior synechiae with SFT and DSEC. SFT remains after DSEC surgery. This is a 14 months follow-up of case in which we had put a multi-piece IOL and is held back, and the astigmatism is neutralized to quite an extent. 13 months follow-up, corneal scar causing high astigmatism is neutralized to quite an extent. 18 months follow-up, the rupture sphincter pupillae. It's easy to dilate while operating, but SFT gives a central circular pupil with excellent visual acuity. These 20 months follow-up cases, SFT is in congenital coloboma of iris, it works good with SFT. The other side may require pupillectomy depending on the visual axis. This pupillectomy done on the other side is a 20 months follow-up case. 6 months follow-up, a small tag, you can see the tag looking part remains forever. I'd never try to dilate the pupil in this case. This 22 months old follow-up cases, the SFT may become loose, but the bridge of the pigment persists. The 18 months follow-up, the growth of the iris tissue is so well that the SFT cannot be guessed. 26 months follow-up case, the rupture sphincter pupillae, the SFT is in upper and lower quadrant both, good tissue growth of SFT. 25 months follow-up case, the rupture sphincter pupillae, just one SFT in upper quadrant remains good. 13 months old follow-up case, rupture sphincter pupil, just one SFT in upper quadrant. The 19 months old follow-up, not enough iris tissue. Pupil so made and has a gap, and the thread is visible. SFT gap may fill up later probably. 19 months old follow-up, pupil could be made smaller, hence they stretch. It couldn't be made smaller, and the gap in the lower quadrant is visible. And 36 months old follow-up, the single SFT, the growth of the iris tissue and the pigment is good for years together. 14 months follow-up, the rupture sphincter pupil, just one SFT in upper quadrant remains good. We had given multiple SFT in this case, and what one SFT is given me, and the pupil is no more central.